On the billing side, Prompt has helped us achieve quicker reimbursement. And what I mean with that is averaging typically between 5 to 10 days, depending on the payer, of the response time. So we're being able to see clean claims and being able to be paid at a quicker rate. My name is Gyn Stackhouse. I am the Chief Administrative Officer. Been with the company for about 7 years. Overall, my role is to be the bridge between clerical, clinical, and billing. Prompt has helped us achieve as a company more connectivity for all departments, whereas one thing that you use, for example, it kind of leads over to the next. So if a patient schedules online, that goes over to the clinical productivity. It comes over to the billing as going into those visits being submitted to payers. From a reporting standpoint with Prompt, I do not have to necessarily do as many manual calculations. And when I say manual calculations, I can easily go to the reporting side and pull my operations report to show me what my visits are averaging, how many IEs I've gotten. Besides that, just averaging for my clerical side as to looking at, okay, how many visits a week are we having in one particular area? So I guess in that terms, Prompt would be, I would say, great at providing that dashboard space. So the dashboard is very clear cut. Clinicians are able to understand eligibility standpoints, visit count, scripts. That also counts to your front side, meaning the front has less work to do. So for example, anything that the front puts into a file, it varies over to the visit count. So for a PT or clinician, they're able to click on their patient, Joe Smith, for today and see that Joe Smith is covered for the next 7 to 10 visits, what the dates of range are, making their note taking and processing a lot easier with making sure that those claims kind of flow quickly. Prompt's dashboard definitely helps with us getting paid sooner and a lot quicker, and it's a lot easier for clinicians to have an eye on not only their discharges, lost patient logs, patients that they can see that are engaging, and patients who have not engaged. From an operations standpoint, making a switch to Prompt would definitely benefit practices from multiple layers, from the self-sufficiency that it only gives to the patients, but the self-sufficiency it gives to your clinical staff and your clerical staff. Being able to have more control over seeing what your clinical staff is actually doing and actually what your clerical staff is able to provide to your patient when they're there. So from the autonomy of a patient having to upload their ID, their insurance card, their script before they even walk into the office, that saves time from them, being at the front and able to get into their quality care that they need.